Dr. Casey Schrum is with us today from Oklahoma State University's Center for Health Sciences. Thanks for being here.
Thank you for having me.
So, what is the mission when it comes to rural health? We hear so much about a rural health crisis in Oklahoma. What is your mission?
Well, our mission is to train primary care physicians for rural and underserved Oklahoma. So the rural health crisis is something that we're focusing on a daily basis in everything that we do.
And how do you recruit someone to say, hey, don't you want to go be a doctor in my hometown of Coweta?
Right, right. So, you know, we are very intentional from recruiting. We kind of refer to it as our pipeline programs, where we really know that there are things that are predictive of where someone will practice mid-career, and those are where someone grows up, where they do their undergraduate work, and how we train them at the medical school. So if we're true to our focus on primary care and rural health, and then where they do their residency training. So all of our programs that we develop are targeted at one of those 4 points in time to increase the likelihood that our students are going to graduate and go back and serve in the communities that we're recruiting them from.
And is that starting to make a difference?
It is making a difference. It does make a difference. You know, when you grow up in rural Oklahoma, you've heard of our Blue Coat to White Coat program.
Yes.
It's the partnership with FFA. It seemed like when we started it, it seemed like a really unlikely partnership. People were kind of scratching their heads a little bit. And I think even when we showed up at some of the agricultural events and we were walking around in our white coats, I think even some of the students and other folks that were there kind of looked at us funny. And now I think that we've, you know, had 5 years now of that partnership. People understand it really is a natural fit, because the people who are going to go back to rural Oklahoma as physicians are folks that embrace that lifestyle, are those students, like students from the FFA, who are bright students who embrace service and leadership, understand hard work, but really, you know, would desire to raise a family and be a part of those communities and practice medicine and still be able to participate in agriculture.
Well, we talked with one of your graduates, Dr. Mercedes Bernard, who's a perfect example of this.
Yes.
And she's currently at a county hospital in Lawton and serves a lot of rural area out there. And she just seemed to be loving it and said she knew from early on that she wanted to do that.
You know, there's something really beautiful about medicine in a rural area, and it's the physician plays multiple roles. There's so much more than just the family physician. They're an advocate for patients' health. They're a teacher. They, you know, they become involved in the community and become politicians and try to, you know, influence people and their health in positive ways. So it's the multiple hats that a physician wears in a rural community that really drove me to pursue that career.
We're real intentional with our training, with who comes in and speaks to our students, who they have mentoring them, where they do their training. We expose them in rural Oklahoma, and many students come in and they get to go spend time in a rural hospital or with a rural physician, and they realize that, you know, that's something that they're interested in, and that there's such an added benefit to being involved in a community, and more than just practicing medicine, but really being a leader and a pillar within those communities. When you are a part of that community, and it's a small community, people don't just see you in the exam room for 15 minutes. They see you, you know, sometimes your kids go to school with their kids, or you're involved in church, or, you know, at the grocery store, just interacting in the community. And there is such a different relationship that you develop, and a trust, that I think when people can see you going, you know, as a physician, they see you as a person as well.
You know, when I thought about medicine, I thought, oh, medicine will take me to the underserved areas in the jungles of South America or something crazy. But that's not the case. We have those people who are suffering and who don't have the availability to basic healthcare needs right here in our own state. And so my passion just kind of turned back around to staying here at home.
And you learned that very early. No one had to convince you.
No.
I know that sometimes that's what some of the mission is at OSU, is to let people know we need you to out in these areas, but you already knew that.
Yes, and I think that that's what's really important about Oklahoma State University. A lot of the or a lot of the residents, or I guess I should say students that they're attracting into their program are students who are coming out of college. They're really fine-tuning the types of characters that they're pulling in, the types of personalities that they're pulling in. A lot of the students are from rural backgrounds. A lot of them have already expressed a desire to go into primary care, whether it be OBGYN or pediatrics or family practice or emergency medicine. Like, they want to do broad scope medicine and go back to their rural home communities.
Having access to primary care physicians is proven to decrease the cost of health care, increase life expectancy, and improve healthcare outcomes. So when we don't have access to healthcare, and you can see that even in the state of Oklahoma, where if you overlay a map where it shows access to healthcare, the places that are lower, the counties that have less access points to healthcare and to primary care, they also have a shorter life expectancy. And certainly that's something that really is just not acceptable, to think that there are Oklahomans who, depending on where you're born and what county you're living in, can lead a shorter life expectancy.
And is that where this mission grew out of, really, to really address those areas?
Right. Yeah, I mean, it really, it is. It was about, I think the College of Osteopathic Medicine and its mission grew out of a need and a desire by the legislature to have health equity for all Oklahomans and to have access and good care, because truthfully, a lot of agriculture and many things that we take for granted, like food and those kind of things, are dependent on those rural communities continuing to exist and agriculture continuing to occur. And so agriculture is a big part of Oklahoma's economy, and having access to health care for farmers and ranchers is important.